We're going to deal with the subject of urinary incontinence. Let's figure out how the system works. These are the kidneys. Tubes that lead the urine to the bladder are called the ureters. The bladder, in this case the prostate, sphincteric mechanism, or the shutoff valve. The tube that goes from the bladder to the outside is called the urethra. With the prostate in place, the bladder has a very definite position within the pelvis, and it is supported there in large by the prostate. The bladder has some unique characteristics. It has what we call compliance, and compliance means that the muscle fibers in the bladder slide one over the other. The bladder can increase in capacity without having pressure within the bladder increased. When the sphincter mechanism is appropriately functional, the sphincter tends to remain closed until there are signals for it to open. There's a large number of men who are diagnosed with prostate cancer each year. And equally important, there's a very large number of men who have prostate surgery for treatment of that cancer each year. About a minimum of 10% have an element of incontinence, and really that number can go as high as 65%. Now, what about prostate cancer causes incontinence? Nothing. It's a treatment. There's a number of very fine nerves and vessels that are associated with the prostate, and surgical removal is the problem. Prostatectomy. Now, the idea is to keep that complication rate very low. The reality is statistics are what they are and say what they say. What about treatment? Well, we want to, of course, get rid of the frustration and embarrassment of, in this case, being wet, depression and anger. And what we want to do is restore quality of life. Management means we're resigned to living with the problem. How can we deal with that best? Can we do better? Treatment seeks to relieve the problem, collagen, maintain that ever youthful look. We can inject that collagen in the area where the sphincter is to make the sphincter work a little more efficient. Think of that leaky faucet when you took it apart and there was this washer in there that was all ground up, and you put a new washer in, you put it in, and by gosh, the faucet turns off and the water doesn't leak. We try to do that with collagen to the sphincter. The most common type of incontinence is stress incontinence, which means if you have a full bladder and you cough, sneeze, strain, oops, leaks. There is a device called a sling. Now, slings were first utilized for women, and slings support the bladder in a position that the normal shutoff valves and muscles can work. Simple solution for a complicated problem. There are more severe kinds of urinary incontinence. There's literally the leaky faucet when the sphincter or the shutoff valve mechanism doesn't come together properly. This is called the artificial urinary sphincter. The cuff goes around the urethra, the pump is in the scrotum, and the reservoir is in the abdomen, totally concealed. The artificial sphincter now has been implanted in patients who have incontinence dating back to the mid-1970s. And I think I implanted the first one in this part of the country in 1977. Here's the device without the clutter of the anatomy. Here it is in action. The bladder's full. You want to be dry. The cuff's inflated. It's time to void. The bladder's telling you it's full. You pump the fluid out of the cuff into the reservoir. The cuff opens. You can void in just the normal fashion. And after about 180 seconds, the balloon or the reservoir will push its fluid beyond the delay, fill, resist, or refill the cuff and increase the pressure in the cuff, creating continence. So there you have it. You don't have to be wet. You know the story. It's up to you. Take action.